Things you can do during childbirth to reduce your risk of severe tearing. Whether you did or didn't prep during pregnancy, there is still a lot you can do during childbirth. I recommend discussing these options with your provider ahead of time. If you feel strongly that you'd like to have the option of any one of these, include it in your written birth plan. 1. Delay pushing until you feel an urge to push. Research shows that folks who wait to push until they feel the urge to push have fewer perineal tears. 2. Consider open glottis pushing. Open glottis pushing is an alternative to the more common breath hold, valsava, technique that you think of when you think of birth. The common breath hold technique involves taking a deep breath, holding it in, and bearing down for a count of 10. In open glottis pushing, you take a deep breath and bear down, but you blow some air out of your mouth at the same time. Open glottis pushing results in less pressure on yoru pelvic floor and may results in a slower, more controlled delivery. If you're interested in trying this technique, it's particularly important to bring it up with your provider ahead of time. It's also important to understand that if your baby shows any signs of distress, you will be coached to hold your breath and push, and you should always follow your provider's instructions. 3. Stop pushing when your baby begins to crown. This gives your perineum time to stretch and yield. You can lift your chin and pant, poo poo poo, to help relieve the urge to bear down. 4. Ask your doctor or midwife to apply a warm compress to your perineum as your baby begins to crown. Ask them if they can continue to offer mechanical support, pressure, on this region while you are pushing. Data suggest that although applying a compress might not prevent all tears, it does minimize the degree of tearing. 5. Learn a few pelvic floor friendly pushing positions. If you have flexibility in how you deliver your baby, consider positions in which the tailbone is free to move. The tailbone is free when you're off your back. Options include squatting, hands and knees, or side lying. If you have a choice, avoid lying on your back. However, for a variety of reasons, we don't always have a choice of the position the baby is delivered in. Ultimately, you should deliver in whatever position feels the strongest and safest for you and your baby. Keeping it all in perspective. Remember, the goal of these techniques is to reduce the risk of tearing during delivery and minimize the risk of incurring a higher degree tear. Sometimes a tear is unavoidable, and it doesn't mean you did anything wrong. Our bodies are also remarkably good at healing from perineal tears. In fact, spontaneous tears generally heal better than episiotomies. If you do experience a perineal tear, I recommend scheduling a visit with a pelvic floor physical therapist around your 6-week OB checkup. They'll be able to help you assess healing, mobilize the scar, and help you with any other post-birth rehab you might need. If you are looking for guidance on returning to exercise after experiencing a vaginal tear, contact me. I offer one-to-one personal training to help you rehab and return to sport after a tear.